Hi, Assalamu alaikum and good morning everyone. Thank you for visiting my channel again. Abdurrahim here with you. So we are continuing our aortic stenosis topic, and today we are going to learn about the severity criteria of the aortic stenosis. In this vlog mainly we are going to discuss about the grading of the aortic stenosis, like how we should grade mild, moderate or severe aortic stenosis, what are the parameters we need to look for, and then we will also see the guidelines, and then we will also compare what is the difference between these guidelines. We mainly discuss about European, British and American guidelines. Okay, so we will start now. For the parameters you need to look for, the first one is the peak velocity or the peak gradient of the aortic valve. The second one is the mean gradient, then aortic valve area, then aortic valve area index, and then the VTI ratio or velocity ratio, or some people call it DVI ratio. So these are the 4 or 5 parameters you need to look for whenever you are going to grade your aortic stenosis, and then you need to look for your findings, and then you need to grade it accordingly. Okay, for the grading wise, you can see now that mild aortic stenosis starts with the peak velocity 2.6 to 2.9, and then the moderate stenosis starts from 3, and 3 to 4 or 3 to 3.9 is moderate, and then more than 4 is considered as severe aortic stenosis. This is about the velocity. If you talk about the gradients, less than 25 millimeter Hg is considered normal, 25 to about 36 is considered mild, 36 to 64 is considered moderate, and more than 64 is considered as severe. This is about the peak gradient. So let's come to the mean gradient. Less than 20 is considered mild, 20 to 40 is moderate, and more than 40 is considered as severe aortic stenosis. Valve area less than 1 is severe, 1 to 1.5 is moderate, and more than 1.5 is considered as mild aortic stenosis. And then valve area index, some people, some of the books or guidelines say don't use the index, but I read in one of the papers that if a patient is very small and the body surface area is around 1.7, then you should not consider 1.7 or less than that, then you should not consider body surface area. Or if someone is having a body surface area of more than 2.5, 2.6, then also you should not consider the valve area index. Okay. And then the next criteria is the VTI ratio or the velocity ratio. If your velocity ratio is less than 25, then it's considered severe aortic stenosis. 25 0.25, less than 0.25 is considered severe. 0.25 to 0.50 is considered moderate, and more than 0.5 is considered as mild aortic stenosis. So this is the criteria. So when you are going to look at the things, you need to look at where your numbers are falling in between this, and then you will grade your aortic stenosis. If your numbers are mixing and not coming properly, then I will tell you what you need to do in the next vlog about it. Now about the guidelines, the European and American guidelines are the same. They say the same what I told you, but the British guidelines, they are slightly different from that, and they also increased one more grade. So they called mild, moderate, severe and very severe aortic stenosis. So this is the British criteria. So if you are following the British criteria, you need to look for that other criteria will be same, but if your velocity is increasing more than 5 and your valve area is less than 0.6, you are going to call it very severe aortic stenosis. So these are the criteria, and this is the grading of the aortic stenosis. And in the by the way, very important thing, sometimes what happens is that your criteria is not matching. Okay, you might be having a severe valve area, but your gradients are mild or mild to moderate or moderate range. So this is very important topic. Sometimes you can have low flow, low gradient aortic stenosis, okay, or paradoxical low flow, low gradient aortic stenosis. I will discuss this this is very important aspect of aortic stenosis. I will discuss this in the next vlog, and I will explain you how you are going to say that is it a low flow, low gradient aortic stenosis or paradoxical low flow, low gradient aortic stenosis, and how you can, how you can confirm your diagnosis about it. Okay. So I'll see you in next vlog with these things. Thank you. Bye bye.